Over the last 24 hours, we have identified 545 new cases of COVID-19 and completed about 8,300 tests. This puts our positivity rate at about 6.5%. We have identified 249 new cases of the variants of concern. About 27% of our active cases are currently variants of concern. There are 288 people in hospital for COVID-19 treatment, including 64 admitted to the ICU. I am pleased to say that no new deaths have been reported to Alberta Health in the last 24 hours. Following extensive discussions with our provincial and federal partners, Alberta is temporarily pausing the use of AstraZeneca in anyone under the age of 55. This is a precautionary measure that is being taken across Canada. As I mentioned to you last week, there have been some rare instances of blood clots reported in Europe that require more investigation. While all available data and evidence shows no increase in the overall risk of blood clots for those who receive AstraZeneca, in a very small number of people who received the vaccine, a blood clot in the brain was reported 4 to 20 days after the vaccine. These incidents are rare, and at this point seem to be linked to AstraZeneca, possibly through an immune response. There is no evidence of any similar issues linked to the other vaccines that we are using in Alberta. There have also been no reported cases of these blood clots following immunization in Alberta or anywhere in Canada. However, safety is always our top priority. This pause will allow Health Canada to conduct further assessments and gather more information from around the world. This change is based on new information reported late last week and over the weekend regarding some additional cases and a lack of a connection to a specific lot or batch of the vaccine. I want to assure you that anyone under the age of 55 who has already received a dose of AstraZeneca vaccine is not considered to be at high risk of blood clots. However, as with anyone who receives any medication, including vaccine, they should monitor their health and seek immediate medical attention if they experience health concerns. We will continue monitoring the emerging evidence around this issue. We will also continue doing everything possible to ensure that our immunization program remains safe and effective. Phase 2B of our immunization program starts tomorrow. This phase focuses on immunizing anyone with underlying health conditions that put them at high risk of severe outcomes if they contract COVID-19. This means that cancer patients, transplant recipients, individuals with severe disabilities, dementia, and other conditions will be able to get the vaccine. The list of conditions is long, and I encourage everyone who may have one of these conditions to visit alberta.ca/vaccine to find out if they are eligible. Based on what we're currently anticipating we will receive in the next several months, we believe we may still be able to hit the end of June target, even without using AstraZeneca. Of course, this will depend on receiving the amounts of Pfizer and Moderna vaccine that we anticipate, but we believe that it still may be possible to meet that target. We are always monitoring our data, not only the overall trends and, of course, the rise that we've seen lately in new cases and subsequent beginning to some increases in our hospitalization that are concerning. So we are monitoring those things. We're also watching to see where our new cases are coming from. And as I've said before, one of the biggest challenges we have right now is that across many different sectors, many people who are feeling perhaps frustrated or tired of restrictions are not following the measures as much as they were before. And so the real question is what kinds of additional measures would be the most effective to help remind all of us that we are not through this yet and that we don't have enough immunizations offered to our population to be able to reduce the risk of a wave of cases becoming a wave of admissions in acute care. So it's something that we look at continuously, but again, no decisions, no recommendations at this point in time.